It's just a regular checkup at a downtown government health clinic, but for MORTICE HARMON, it's an important part of his plan to stay HIV negative.
To still be lucky to say that, you know, at the age of 30, I never had an STD before, you know, and I'm negative, you know. I think that's a big accomplishment, and a lot of people nowadays are not even making it past 18, 17, I mean, they're really young.
A recent study found that 1 in 2 gay black men living in Georgia will contract HIV during their lifetime. But it's not just gay men and intravenous drug users who are at risk. In Georgia, a quarter of those with HIV are women, and most of them, like PHYLLIS MALONE, are heterosexual. She says she contracted HIV from a man who didn't know he had the virus. Now she works at a women's sexual health centre.
I was out there having sex, period. So when I found out I was positive, I stopped that all completely. I stopped, my whole life changed. I started being careful for other people.
In Georgia, the Republican-controlled state government allocates none of its $4.3 billion health budget to HIV prevention. School-based sex education frequently focuses on abstinence and is left largely up to each school district. And along with a number of other southern states, Georgia has refused to expand Medicaid to hundreds of thousands of poor people. It says the mostly federal-funded insurance program will end up costing the state too much. This billboard is part of a public awareness campaign that's being rolled out citywide to encourage people to get tested. It's an unusual sight here in Atlanta because Georgia is a mainly conservative state, and one in which until now is largely denied that there's an HIV problem. That's why the federal government has stepped in and is paying for the campaign and this screening bus which tours shopping centres in and around Atlanta.
That's willful neglect. You have a national strategy that's a blueprint for how to address and reduce the HIV epidemic, increase access to care, address some of these other health disparities. But willful neglect says we're not going to even do a state level kind of plan like that.
Church leaders say their community needs to do more to encourage people to get tested.
We have preached damning messages from our pulpits that have created stigma and a lot of self-stigma. And I think we have to get back to the Bible basics and preach love and acceptance.
Back at the clinic, MORTICE HARMON has tested negative, but many health workers say until the government recognises the problem and spends more money, the HIV crisis in the southern states is likely to get worse. Tarek, Bazley, Jazeera, Atlanta, Georgia.